Prostate cancer is a silent threat, often creeping up without clear warning signs in its early stages. It doesn't announce itself with immediate pain or discomfort, and that's what makes it dangerous. Many men continue their daily routines, completely unaware that changes are happening inside their bodies. Changes that, if caught early, could be managed, treated, or even prevented from progressing. The challenge is that prostate cancer symptoms can be subtle, easy to ignore, and often mistaken for normal signs of aging. However, recognizing them early can be life-saving. You might think that if something were wrong, you'd feel it. After all, pain or sudden discomfort usually tells us when our bodies need attention. But prostate cancer doesn't always work that way. It can quietly develop for years before causing noticeable problems. And by then, the disease might have already advanced. The good news is that being aware of the early signs, understanding what to look for, and knowing when to seek medical help can make a significant difference. The sooner a problem is detected, the more effective treatment options become. One of the first warning signs many men experience is an increased need to urinate. Especially at night, it might start gradually. You wake up once in the middle of the night, then twice, and eventually, you find yourself making multiple trips to the bathroom, disrupting your sleep. You may chalk it up to drinking too much water before bed or simply getting older. But persistent nighttime urination could indicate something more. The prostate surrounds the urethra, and when it starts to grow abnormally, it can press against the bladder, reducing its storage capacity. This makes you feel the need to urinate more often, even when your bladder isn't full. Another common but often ignored symptom is a weak or interrupted urinary stream. You may notice that your urine doesn't flow with the same force as before. Or perhaps it stops and starts, making it difficult to empty your bladder completely. You might even experience dribbling at the end, a sign that something is obstructing the normal flow of urine. This is because an enlarging prostate, whether from benign prostatic hyperplasia, BPH, or cancer, can narrow the urinary passage. Over time, this symptom can worsen, making urination more frustrating and uncomfortable. Difficulty initiating urination is another red flag. You feel the urge to go, but when you try, nothing happens right away. You wait, push, and eventually, the stream starts. But it takes effort. This hesitation can be unsettling. And while it might not seem like a big problem at first, it's a sign that something is interfering with the normal function of your bladder and urethra. Tumor growth can disrupt the connection between the bladder and the urethra, creating a blockage that makes urination increasingly difficult. Some men experience a sensation of incomplete bladder emptying, feeling as though they still need to urinate even after just using the bathroom. This could mean that urine is being retained due to an obstruction in the urinary tract. When urine remains in the bladder for extended periods, it can increase the risk of infections, causing additional problems that further complicate the situation. Frequent, unsuccessful trips to the bathroom can also take a toll on your quality of life, leading to frustration and discomfort. Pain or a burning sensation during urination can also signal a problem. While urinary tract infections are common and can cause similar symptoms, persistent pain should never be ignored. Prostate cancer can cause inflammation, changing the chemical balance of the urinary system and making it more sensitive. Some men describe this pain as mild irritation, while others feel a sharp, intense burning that worsens over time. If the discomfort persists even after treating a potential infection, it's critical to get a thorough medical evaluation. One of the more alarming but less frequent signs of prostate cancer is the presence of blood in urine or semen. Seeing even a small amount of blood can be frightening, but rather than dismissing it, it should be seen as a clear indicator that something isn't right. Prostate tumors can cause small blood vessels to rupture, leading to traces of blood that may or may not be immediately visible. This symptom, even if it only happens once, should prompt an urgent visit to a doctor. Pain in the pelvic region, lower back, or upper thighs can also be a warning sign. Discomfort in these areas, especially when it's deep, persistent, and doesn't improve with regular pain relievers, could indicate that the prostate is enlarging and affecting surrounding tissues. Prostate cancer can also spread to nearby bones, causing chronic pain that worsens over time. Many men dismiss this discomfort as a sign of aging or general back pain. But when combined with other urinary symptoms, it becomes a reason for concern. Some men experience painful ejaculation, a symptom that is often linked to prostatitis or prostate inflammation. However, when pain during ejaculation becomes chronic and doesn't improve with standard treatments, it's essential to consider the possibility of cancer. Malignant cells can alter the prostate's structure, leading to persistent irritation and discomfort. This can impact not only physical health but also mental well-being and intimacy, making it even more important to seek medical advice. Unexplained weight loss can also be a subtle but serious sign. If you haven't changed your diet or exercise routine but are losing weight without explanation, it could indicate that your body is working overtime to fight off an internal threat. Cancer cells consume energy and alter metabolic processes, leading to a gradual decline in body weight. This kind of unintentional weight loss, especially when combined with fatigue or other symptoms, should never be ignored. Chronic fatigue is another often overlooked warning sign. Feeling exhausted even after a full night's sleep, experiencing difficulty concentrating, or lacking the energy to complete daily tasks may indicate that something is wrong. Prostate cancer can affect energy levels as the body works to combat the disease, draining reserves and leaving you feeling constantly tired. Erectile dysfunction that appears suddenly and without explanation is another potential indicator of prostate issues. While many factors contribute to ED, including stress, cardiovascular problems, and lifestyle habits, prostate cancer can also play a role. Tumor growth can disrupt nerve function and blood circulation in the pelvic region, leading to persistent erectile difficulties. If traditional treatments for ED don't seem to work, a prostate health check should be part of the evaluation. As prostate cancer progresses, it can spread to bones and joints, causing significant pain. This is particularly common in the lower back, pelvis, and ribs. Many men assume this pain is due to aging, arthritis, or past injuries, but when combined with other prostate-related symptoms, it raises the need for medical attention. Seeking medical help as soon as symptoms appear is crucial. Experiencing one or two of these signs doesn't necessarily mean you have prostate cancer, but ignoring them could lead to delayed diagnosis and fewer treatment options. Regular medical checkups, PSA screenings, and imaging tests can help catch the disease early, improving the likelihood of successful treatment. If prostate cancer is detected, treatment options vary based on the stage of the disease. Active surveillance may be recommended for low-risk cases, where doctors monitor the tumor without immediate intervention. Surgery, radiation therapy, hormone therapy, and chemotherapy are options for more advanced cases, each with varying risks and benefits. Emerging treatments like immunotherapy and targeted therapy provide new hope for those with aggressive or treatment-resistant cancer. Side effects from prostate cancer treatments, such as urinary incontinence and erectile dysfunction, can be challenging, but modern medicine has developed solutions to help men regain function and improve their quality of life. Pelvic floor exercises, physiotherapy, and rehabilitation programs can make recovery easier. Lifestyle adjustments play a crucial role in both prevention and recovery. Maintaining a balanced diet, engaging in regular physical activity, managing stress, and getting enough sleep all support prostate health. Prioritizing medical checkups and being proactive about symptoms can make all the difference in ensuring early intervention and better outcomes. Awareness and early action save lives. By recognizing potential warning signs, getting regular screenings, and making healthy lifestyle choices, men can take control of their prostate health and ensure